Everyone Included is a vision for the future of healthcare based on a framework of mutual respect and inclusivity. We believe everyone should be respected for the expertise they can bring to discussions about the future of healthcare. Here are some of our stories.
It was really probably one of the most profound and important messages on the main stage this year, in my opinion, was that statement that a failure for a provider to recognize and explain the importance of social support is a medical error. That was so profound. And the fact that you had to say it.
It felt like the most simple message.
Right?
Yeah. It's sometimes the simple things staring us in the face that are the hardest to accept.
And that's what hit me so hard when you said it. Why did Julie have to say that? Because that's not our reality. That's not our reality. How do we get that conversation, social media, to reach other people outside of that patient community? Well, how do you see it happening? Imagine
the
for
$1 million question.
Imagine for me, how do we get people to hear each other?
Right. You know, that was one of the things that caused us to start the healthcare hashtag project. Our initial goal was to lower the barrier of entry for providers. We felt that there needed to be providers involved in these discussions online. And so we knew that was going to be frightening to a lot of providers as they start to stick their toe in the water. So we wanted to just simply enable them to find subjects that they were comfortable in sharing their expertise in, finding their own peers that they could interact with and start to get to know better and test these waters together. And that was really what our initial goal was. We didn't expect to see so much patient activity. That was the surprise to us. People talking about these what would otherwise be very deeply personal, private circumstances having to do with their own health. That was what was not expected.
So Tom and I spend so much time in data, but one of the things that I'm afraid of is that we optimize for the data. But we know that what we're looking at can't explain everything. Like, we're just looking at this one little piece. So if you as a healthcare provider, doctor, or as a patient, you have all these metrics, so you're a self-tracker. But that's only one piece of your health. And there's very, very big areas that make you a healthy person that you can't put a number on. And so you may be really optimizing for those numbers, but you're ignoring pets, trust, relationships, community, friendships. And so, how can we be conscious about these areas you can't track?
Being told when I was a teenager that I was going to be in a wheelchair by the time I was 25. I said, I'll be damned if that's going to happen. And so that motivated me to start doing research. That was part of the motivation for becoming an e-patient, is that, I didn't want to be there. I was scared of it. And it's still something I'm actively scared of every single day, that maybe tomorrow's the day I wake up and can't walk, can't do that. And this recent incident with me was, pretty scary in that regard. But it actually, with the problems with my foot that I'm having right now, it's motivated me to take even better care of myself and really caring about my mental health, sleep, how much sleep I'm getting, what I'm eating, how much water I'm drinking, all of those sorts of things. That motivation is you have no other choice. I say to people sometimes, and I don't think they grasp that I'm actually serious, is that some days literally just getting up and maybe showering for the day and then getting back to bed, that is a success, for the day. And, someone said that yesterday. She said, I made it through the day. She said, should I be proud of myself for that? And I said, gold star.
What I'm getting out of this discussion above anything is this is why healthcare is so difficult and such a hard problem, because there's no simple solution for everyone. We talked about the bias of data, and sometimes data helps you, but sometimes you're so focused on the data that you overlook the other important factors which can't be tracked. And then the other thing that makes it difficult, I think in healthcare and medicine, we're so driven and have this culture of negativity and fear, like that we should change the behavior because we're scared that something's bad will happen, or that we're always blaming ourselves because we didn't adhere to the medication, or I didn't follow my diet plan, or I failed, I fear. And I just don't know why we can't change that frame to something more positive.
I've started a new hashtag just a few days ago. Hashtag today's tiny triumph. Every day has a tiny triumph. It's hard for me to do, but by trying to force myself to even think of what is today's tiny triumph, and sharing that, I think that's just trying to help me change that mindset.
I think we should. It's getting cold. I'm cold. I think we should toast. Let's do a toast to today's tiny triumph, and then go get warmer inside.
Sounds good.
Cheers.
On the next episode of Everyone Included. How do you help people get past a roadblock if it's not in their skill set? And I think the brilliant idea there is to get the partnerships.
Groups of academics or groups of patients, and submitting their own individual projects, but to see them come together on a single research team, all bringing these different points of view together, and to collaborate on
is create a lot of awareness. There's a wealth of data here, and we want to do something, but too few people actually doing something. So we wanted the researchers to get going on this kind of data set.